So monitoring my braces patients with DM means that we can check what's happening before they even come into the appointment. So our pre-planning is great. We can save appointments because we can just wait till the archwire is passive before we need to see them. We can set some goals to know that when we do want to call them into an appointment, they're really ready to come into an appointment. Or if the patient's got a problem, they can send us some photos and we can often troubleshoot that without making them come in. So my braces workflow's changed slightly since using DM, although not a lot. I already had long appointment intervals, which actually gave time for my wires to work, but now we can be much more specific about when we need to see the patient to do something. So in that way, checking it and then altering it has modified it slightly. So the observations that I can get out of DM, there's about 130 of them, and I don't always look at all of the observations all of the time. For braces, we're looking for, broken brackets, long wires, oral hygiene, which is feedback automatically back to the patients. And for me, in terms of accuracy, there's rarely anything that I would deem to be inaccurate. Often it just means something we need to go and check, either clinically or just get the patient to rescan so we can see something in particular. So using DM to monitor our patients means that we have very few emergency type appointments because it's not an emergency. We already know what's happening when the patient's coming in, if there's a long wire, broken bracket, or God forbid, some sort of trauma that they've had. And that also means that if there is an issue and we do need to see them, then we can triage better because we know what we're setting up for and what we're dealing with. So my favourite feature about DM when I'm monitoring braces patients would be the fact that before the patient comes to the appointment, we can check DM, know if they've been scanning on time, what they're up to, their oral hygiene, and what wire we're in, and whether we have any repairs so that we can have a planned appointment without unanticipated things happening. My braces patients, I have fewer appointments for them, and when they are here in the chair, often that appointment will be a little bit longer than perhaps it was prior to dental monitoring because we're going to maximise what we're doing when we do get them to come in and get a lot of bang for our buck in terms of what we do in that appointment. So we use goals for our DM monitoring because that way we actually set some specific things that we want to meet the goal in terms of when they're going through their patient journeys. So I use archwires passive in the initial aligning wires, and then once we're in looking at our class 2 correction and space closure, we'll use those goals as well. So I'll set up those goals as we go along, or I'll just give it to one of the staff to set that up as we go. So oral hygiene is overall better with dental monitoring because the patients are obviously aware they're being monitored, and that means that they're actually paying attention to their hygiene. Now, I was already like a bit of a police on oral hygiene anyway, so it's hard to be bad in the practice. We still have bad patients, but overall it's definitely better, and the patient feedback has been that they like that as well. Feedback from patients have been immediately after and during COVID was thank God we did dental monitoring. It made life so much easier when we were in lockdown. Since then, we've run a patient satisfaction survey, and from that, the flexibility, the fact that they could communicate with me easily, they didn't have to make like long 2.5-hour trips for appointments. They felt more involved in their treatment process because they could ask questions when they needed to, and they could troubleshoot better anything that they had some concerns with. So if you're thinking about using DM to monitor your braces patients, my advice is just do it. Because my theory when I started doing this was if I saved one appointment, it actually paid for itself really easily, and it's done that way more than that. So would I go back to monitoring braces patients without DM? Not if I absolutely didn't have to. It's actually changed significantly how we work and made life 1000% easier.